Today we're going to be talking about substance-related disorders. Substance-related disorders have been around for centuries, even though people have been in denial for centuries. One of the reasons we have this in the DSM is because addictive behavior is one of the most prevalent and hard-to-treat mental health problems that our society is struggling with today. Within this category of illnesses includes substance abuse, dependence, tolerance, and withdrawal. Substance abuse involves excessive use of a substance that can result in harmful behavior while they're intoxicated, or the continued use despite life problems like social, psychological, occupational, or health problems. Substance dependence includes the use of substances that increasingly larger amounts because your body has developed a physiological need for that substance. If you're dependent, then your body will show a tolerance for that drug or experience withdrawal symptoms when you can't get the drug. Tolerance is when you need to increase your substances in order to get your desired effect. For example, meth users will continue to use larger amounts of meth in order to get that first high, and that will never happen. They will never get that high back. Withdrawal means that you will have physical symptoms when you don't have the drug in your system. What many people don't realize is that drugs and alcohol can impact your brain and the activities that it performs. Not only does it impair functioning, but it can kill and alter brain cells, create a biological dependence, cause psychosis, and even induce dementia or schizophrenia. Psychoactive drugs are categorized into 5 different categories: sedatives, stimulants, opiates, hallucinogens, and anti-anxiety drugs. Sedatives are drugs that reduce tension, blot out feelings or events, or cause a physically depressant state. These can include alcohol and barbiturates. Stimulants increase alertness, decrease fatigue, even cause you to stay awake for longer, and may stimulate the sex drive or increase your endurance. And these can include amphetamines, meth, and cocaine, and even caffeine and nicotine. Opiates are drugs that alleviate pain, anxiety, or tension, and they can include opium, morphine, heroin, or codeine. Hallucinogens induce a mood change, a change in your thought, or a change in your behavior. And these can be ecstasy, marijuana, LSD, or PCP. And finally, anti-anxiety drugs alleviate tension and anxiety, as well as induce relaxation and sleep. And they are Xanax, Valium, or Librium. Gambling is also considered an addictive disorder because of the addictive personality traits that are similar to those in substance abuse disorders. This disorder is maintained by short-term goals, you win, or there can be long-term disruption in their lives, they lose their spouse, but they still keep doing it. As far as treatment for these disorders go, it can be very difficult to treat. Those who abuse and who are dependent on drugs, alcohol, even gambling, refuse to admit they have a problem. With any addiction, there is going to be denial. And so some of the treatment options include 12-step groups, harm reduction, both mental health and substance abuse counseling together, medications, and even long-term residential facilities.